that I got a really interesting question sent in about warfarin. And one of the things I think that was a takeaway from the drug information on warfarin was that it is a dangerous medication. It's a high alert medication because of the risk for bleeding. It's a difficult medication to manage because it is highly susceptible to changes in diet, and it interacts with everything. So anytime a patient changes the amount of vitamin K they're consuming through diet, anytime they start taking a new medication or substance or supplement, or they stop taking something they were taking, you have to completely reassess the patient's warfarin therapy. So the gist of the comment the student sent in is, why on earth is that drug even used anymore if it's so dangerous and so difficult to manage? And I thought that was a really good question. So it's just an opportunity for me to note that every single decision to use any medication comes down to determining whether the benefits of using that medication outweigh the risks. And this is true for anything, even the most benign of substances. So there's always a risk-benefit calculation. And obviously with a high alert, high-risk medication like warfarin, we're only using that drug in patients that have a serious health condition that requires treatment with an anticoagulant medication. So the common indications for warfarin are to prevent, or I should say reduce the risk of strokes in patients that have atrial fibrillation, to reduce the risk of strokes in patients that have mechanical heart valves, because blood can pool and clot on those heart valves and basically get sent to the brain, or to reduce the risk of recurrent venous thromboembolic events in patients that have had deep venous thromboses or pulmonary embolism. So those are some of the common indications for warfarin, and those are potentially life-threatening or at the minimum debilitating health events. So if you don't treat a patient that has a mechanical heart valve with an anticoagulant, they have a fairly high risk of having a stroke within a given year. And that stroke can be permanently disabling or potentially fatal. So yes, the risks with warfarin are high, but the benefit is substantial in that you're potentially preventing a serious health consequence. Now, that also being said, there are newer anticoagulant medications that have come out over the past couple of decades that do have advantages over warfarin for many patients. Some might argue most patients. The considerations are, there is a cost consideration for that. Some of these drugs are more expensive, and that's unfortunately always part of the equation. And a lot of providers are comfortable with warfarin because it's been around for over half a century. There's tons of data about warfarin. It has its challenges, but providers know how to use it. They're familiar with it. The newer drugs are newer. The data is not as broad and as old, although in the recent years, we have been accumulating data that shows these newer drugs are probably better for a lot of patients. So we are seeing less warfarin use and more use of the newer direct-acting oral anticoagulants. But, that would be my comments around why this drug would ever be used when it is so high risk.